Bill, how about over at Defense Healthcare? And why don't you give us a minute on sort of, what is the role of, people think about DoD and the EHRs there, and then I think about, VA and what they're doing and interfacing, and maybe a quick 101 on what is all that, and then what's your role in implementing all this?
Well, so what we're doing, and actually, I think it was interesting listening to Mark, Jose, and Shamander. It was almost like being at a staff meeting this morning, the topics that they covered. So what we do at PEO DHMS is Defense Healthcare Management Systems, is we're charged with being the DoD provider of health IT. Originally, the new EHR, electronic health record, called MHS Genesis. There's an operational medicine role and a data accessibility role as well. But what's been going on the last year is pretty exciting, and that is taking what we're doing with what in DoD we call MHS Genesis, and working with the VA and working with the Coast Guard, and making it, and going beyond Mark's comments about interoperability, at least within the federal healthcare providers, and making it a common record, not an interoperable record, but a single record, a common record about the patient, not where the care was delivered or who delivered the care. And we're making great progress on that. This month, the Coast Guard goes live with their initial sites, their initial wave. In the very near future, the VA is going to go live. And DoD has 8 sites live at this point, and continue, and has a schedule that takes us through 2023, delivering a modern EHR to the military health system. But it's a single record about the patient and not where the care is delivered. It's very, very exciting. And then the other thing, Mark talked about, he talked about access to your own record, but it's more than that from a data perspective. I had another program, it was the operational medicine program, and going through the response to the COVID experience, it has proven to me, and I think this was covered a little bit, or at least touched on by some of the folks before me, but it's not about operational medicine, right? What we viewed in DoD as operational medicine, which is delivering the data about the right patient to the right provider at the right time, based on the characteristics of the care that needs to be delivered and the technical characteristics of the environment. We thought of that as operational medicine. So it gets the common operating picture, right? We all talked about common operating picture. We also have common operating picture efforts underway domestically, but we were able to capture what we were doing with the operational medicine capabilities and bring it domestically and apply it to the COVID situation, and then look at how do we extend this, and as we're looking at this, how do we extend this across non-traditional healthcare delivery environments, the capabilities that we already have, and how do we extend them. So that's what we're doing, and that's telemedicine. Shamander mentioned telemedicine and what the VA has accomplished there. And from a DoD perspective, and this joint federal approach to providing the electronic health record, DoD is leaning into what the VA has done and the success they've achieved there, and trying to adopt the same set of tools to extend the clinical workflows that we create through MHS Genesis to different environments and non-traditional environments.